In today's news at Dr. Raj Plastic Surgery, just kidding, we're just trying a different view today. I'm going to talk about a very, very important topic. It's actually related to the psychological impact of having cosmetic surgery. We think that, okay, we're going to have surgery, everything's going to look great, we're going to be amazing, and then the following day we can just go back to our life. Unfortunately, it doesn't work that way. It's a big, stressful day in a way because you're going under anesthesia, you're getting a lot of medications, familiar surroundings, you have all these dressings, you've got a garment, you're just not your normal self. I was actually shown this curve by one of my mentors, and I think it's so true. So the first week is truly an emotional roller coaster full of ups and downs. It is very important to have a support system, people to help you. You're going through this process of recovery. You're dealing with bruising, swelling, discomfort, areas of numbness, drains. I mean, the list goes on. And a lot of patients are like, wow, what did I get myself into? I wanted to have surgery to look better, but now I'm dealing with like 10 to 15 different things that I never imagined. And it's interesting. I have a few patients that will hire nurses in Dallas to help take care of them at a hotel or in a recovery house just to deal with all these things because there is a lot to it. And the better prepared you are, the more knowledgeable you are, the better this process goes. Especially if you have young kids, it's better to have people to help you with them. The more you know, the better. The better prepared you are, by having the right dressings, the right understanding what to do with the garments and the drains, when to take your medications. I mean, it's all very key and makes that emotional roller coaster a little bit better. And week 2, patients are feeling better, a little bit more energetic, but they start looking at the results a lot more. So let's just throw an example out there, like a breast augmentation. Before surgery, patient may feel like they want to be bigger, but they're not really looking at their nipples and all the asymmetries, and they're not nitpicking. And a common thing during the early stages of the recovery, once patients are feeling better and off of the pain meds, is they start really analyzing the results. I think that's perfectly fine. Definitely need to analyze, make sure everything's going okay, make sure your surgeon knows what you're experiencing, but there's a balance. You don't want to overdo it and have this paralysis by analysis where it's like, oh my gosh, I noticed this stitch, or this is off by a millimeter, or this nipple's bigger than the other. So you don't want to get too hung up on those things. If you notice those things, best to just check with your surgeon. Say, hey, is this normal? Is this something I should be expecting? Did you know about this? You just don't want to get into too much in your head the second week. What I've noticed the third week, this is where patients, I feel the energy levels are high, the swelling and bruising has mostly gone down. It doesn't really look like they've had surgery in a way, and things have healed a fair amount. And so patients like to start showing off the results or maybe talking about it with friends or taking pictures. These days with social media, patients are posting selfies either on different forums or online. And so week 3, week 4 is where I noticed that. And assuming everything goes well, no complications, no issues, everything's healing beautifully, at the 1 month mark, most patients are very happy. And what was kind of seen on table is starting to be visualized at the 1 month mark. But keep in mind, with most procedures, it takes about 3 to 6 months to fully heal. And everybody has a different timeline. Some people heal faster. For some people, the swelling hangs around a little bit longer. That's why it's very important during this whole process. Stay positive, follow all the instructions, and if you have any questions, concerns, always check with your surgeon. And make sure they help you kind of get through things and help you kind of understand what's going on. Hope this video helps for you to get an idea of how the whole psychological impact of surgery is afterwards.